Hi, my name is Bárbara Oliveira. I'm a co-founder and chief clinical officer at Luminate Medical, where we are building medical devices to reduce the side effects of chemotherapy for cancer treatment. All of my research and academic career was connected to breast cancer and really in the imaging space. So I've always been interested in developing and improving solutions for getting better images of the breasts. So I've been connected to this space for a long time, and I understood how prevalent it is, how much it affects women, as a more broader point, how much it affects people in general. And once I finished my PhD, I had the opportunity to start working on a clinical trial of a breast cancer imaging technology. And during that trial, I was exposed daily to cancer patients. I understood how difficult it is for them, how difficult are their journeys, and how much of a burden it is. And it was a really great experience. I learned so much about clinical trials, but I really was seeing these patients day to day and really experiencing how tough of a time it is for them. So at this time, I met my co-founders who were both very interested in quality of life needs. So that's Aaron Hannon and Martin O'Halloran. Martin was actually one of my PhD co-supervisors. And we just got together and understood that we had this common interest around quality of life, and we thought that there had to be something better that we could do. So really, my journey has always been one of focusing on the lesser heard voice, and that's really what we're trying to do at Luminate Medical, to create solutions that these patients that are often not heard at all, their needs are, their quality of life needs aren't answered so much. So that's really what my focus has been. Luminate, we're obviously a young startup. We started in 2019 developing our technology. Actually, once I look at it now, it's been a few years. So earlier this year, or I should say in 2023, we were able to develop the first generation of our device to reduce hair loss during chemotherapy. So that's the Lily device. And we brought this device out to a clinical trial. So in this it's the first clinical trial of our technology. It's been a really great opportunity to connect with patients, see if we are delivering what they need. And it's just been really amazing to see the impact that our technology can have in their lives. And it's not just in their lives, it's in their lives and in their families' lives. So often patients have family members coming in to the chemotherapy session. So it's been really great to see the positive impact that our technology has on patients, how they feel about themselves, and how the family is connected to all of it. Again, I have been in the world of STEM and engineering for a long time. That's how I started my studies in biomedical engineering. And then I continued on to a master's, continued on to a PhD, and then proceeded on to founding a company in the world of medical devices. So the more I progressed through my career, the more I realized that the playing field is not really level. So women in engineering and women in STEM are a minority, and sometimes that poses some challenges. The less women you see in the career you're trying to pursue, maybe the more difficult it feels like it is. It means to me that we all have a part to play, and we can all contribute to equality between men and women. As a word of encouragement to perhaps young girls that are only starting to study, or young women who are starting to choose their degrees or finishing their degrees and don't know what to do. I think really, you've heard this in other places, but you can do what you set your mind to. You can find amazing mentors in your life that will help you and push you along. I've had amazing mentors that haven't just been women, men as well. I co-founded a company with two male co-founders who have been such great advocates of my mission as well. So I think it is possible. And I would really say surround yourself by the experts in the field and by people that push you and trust your mission and that want to make you succeed. So I think it's a really good moment. We're starting to see more women in STEM and engineering creating companies. So there's a lot of momentum behind more women having access to more opportunities. Has actually been really important. So we've done a number of interactions with the EIT Health, and I think most notably we participated in the Catapult program, where we ended up being quite successful, and we had the amazing opportunity of having our logo displayed on the NASDAQ tower. So I mean, even starting with that, to be able to have that opportunity through the EIT Health program is amazing, because it does get our name out there, and it just connects more people to our mission, which is really what we want to do. We want people to know about what we're doing so that we can reach more patients and help more patients' lives, really. So even that example for me is an amazing example of what EIT Health can do for us. And as well, through the programs that we've participated in, we've always gotten connected to really great mentors and advisors. So that's been obviously really valuable, and just expanding our network through the EIT Health space has been another great opportunity.